Coming up next on Arizona Horizon, how would the Senate Republican health care bill impact Arizonans with disabilities? It's National HIV Testing Day with the theme Test Your Way, Do It Today. And we'll hear from the coach and star player from ASU's National Championship women's golf team. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. The U.S. Senate today delayed a vote on its plan to repeal and replace the Affordable Care Act. The delay until after the July 4th recess gives Senate Majority Leader Mitch McConnell more time to shore up support among fellow Republicans. No delays in protests against the bill, though. Indeed, this morning, several groups held a press conference and an event to discuss the GOP plan and the Congressional Budget Office's analysis that 22 million people would lose coverage under the proposal.
Millions of people, veterans, disabled people, those are the people that really count on that health insurance that's accessible, affordable, and comprehensive. So I just wanted to give you what the face looks like of an insurance.
Among those especially concerned with the proposed health care plan are people living with disabilities or physical challenges. And joining us now is Amina Donna-Kruk, Vice President of Advocacy for Ability 360, Arizona's largest center for independent living. Nicole Geisey, who has a daughter named Brooke, who has a rare genetic disorder and who relies on Medicaid. And Ability 360's Don Price, who lives with a spinal cord injury and has health care through his employer. Good to have you all here. Thanks for joining us.
Thank you.
Amina, we'll start with your thoughts on this plan that now has been delayed, but it's still going to be addressed once we get past July 4th.
Yeah, and I think it's going to be a really, really tough fight, but people are so confused about health care. And I think when we talk about people with disabilities, that is seniors, that's people across all political, economic, ethnic groups. We are a diverse group, and it's an equal opportunity club. Nobody ever knows when they're going to get a disability. A gentleman I talked to just yesterday, he was 25, very healthy, suddenly got multiple sclerosis. Went in the hospital, came out, what was it, $800,000 later? Mm-hmm. And luckily he had employer insurance, but what happens if he doesn't? There's caps on expenses in this bill. There is, it says there's no pre-existing condition clause, but that's going to be up for debate between the House and the Senate because that's part of how they can do the affordability of the bill. So anyway, it's just going to be very difficult for students who get care in the schools that comes from Medicaid. They get services, they get equipment. People who are living in nursing homes, 3/4 of those people actually end up using Medicaid dollars to help pay for that.
Okay, Nicole, I know that you have your daughter, and how does it work now with your daughter, with Medicaid, with services? How would that change under this plan?
Well, I can tell you how it would change because we've lived through that actually. Before she was on Medicaid, she has several therapies that are once a week, and that was $45 per therapy. Every week, and we were just struggling financially. We're a one-income family, and so when we finally were able to get underneath Medicaid, once we had a diagnosis for her, Medicaid came alongside us and really helped supplement those costs for us. Instead of struggling, we were finally able to build our finances back up. And if we lose that supplement that we've had, then we now have to either make that up ourselves, which we are a family of 4. Brooke has a very demanding schedule, so finding a job that is flexible with her health care, it's challenging if not impossible.
It sounds like a very big difference. Don, what is the home and community-based services provision of Medicaid? Because I think a lot of people have no idea what that is.
Well, yeah, as you mentioned, I live with a spinal cord injury. When I was 18 years old, I was swimming with friends. I dove into a lake and broke my neck, and in that instant became a person with quadriplegia. So I quite literally am not able to get out of bed in the morning, get myself dressed without a helper. And this Medicaid that I use allows me to have an in-home healthcare helper to help me do those things. And really, I mean, the other option would be in a nursing home. And I'm 53, I feel young, I'm still active in the community. I don't want to be in a nursing home. I don't know anybody that really wants to be in a nursing home. So allowing me to have that care in the community, in my home, it makes my life wonderful.
For you and others, if this GOP plan, the Senate plan, goes through, what changes?
The scary thing is I really can't tell you. I mean, we hear different stories from different sides. All I know is that it's easy, I think, for legislators to just see numbers and dollar signs and just say, well, you know, we can cut that without seeing the faces and the people that it's going to affect. And that's a lot of people like me.
Yes.
And I don't know what's going to happen, and that's what scares me the most.
Could cut hours that he gets for help, and Don works. He works full time because he has personal assistants that can get him up in bed. If he was in a nursing home, he wouldn't be able to get up in time to go to bed. The nursing homes aren't run that way. He has choices about what he eats. He does his own shopping.
And we should mention, you do get health care through your employer right now.
No, I use my Medicaid program.
So you do use, so this is going to affect you.
Yeah.
It will, yeah.
Yeah.
And I also pay a premium, a monthly premium for that
Called the
health
Medicaid
care.
Buy-in Program, Access Freedom to Work.
Oh, that's okay.
And
Yes.
specifically for people with disabilities that work. So he could get employer health care, but what people don't understand is that extra care that's what we call long-term care, where you get personal assistance to help you do things, that is only Medicaid. There's very few people who have any kind of insurance that will cover that, and employer insurance, regular insurance, does not cover that.
If someone's watching right now, let's say Congress is watching right now, and they see you, what message do you want them to get?
I just want to know, how does it make sense? If we invest in our situation, our daughter's 6 years old, and if we invest in her now, which the services she's receiving are mostly through Medicaid, then that allows her to reach her full potential. So then later in life, she can become less dependent upon others, more independent. She can become a contributing member of society. And if we deprive her of those services and stifle her, and that makes her more dependent upon society, how does that make sense if we're, like you said, if we're looking at the dollars and the figures and the numbers short term, we need to be looking at them long term and make sure that if we're making any cuts, they make sense as a whole.
Don, you've got Congress right in front of you. What do you tell them?
I tell them to vote no against the Medicaid caps. I tell them to find a better way to make our health care work. I mean, work together. I mean, it's the red team versus the blue team right now, and nobody seems to be listening to each other, and especially forgetting about their constituents, the people that really need the help.
Final word. I mean, we got 30 seconds left here. I mean, are we just headed for a hybrid kind of single-payer system? Is that what we're bound to wind up with eventually?
I don't know what we're bound to turn up with, but part of the reason this program isn't working right now and insurance companies are leaving is because Congress has decided not to continue some of the funding that it was doing before, and insurance companies are afraid. So part of what makes Arizona look like a dangerous state, because we don't have very much coverage from insurance plans for the marketplace. So my concern is most of those people that are on Medicaid and Medicaid expansion are people with disabilities or family members taking care of them, or students who need the health care, and nobody knows when they need it till they get it. So if you limit what they get, then now all of a sudden they need it.
All right, we have to stop it right there. Good to have you all here. Thank you so much for joining us. We appreciate it.
Thank you.
Up next on Arizona Horizon, it is National HIV Testing Day.
Hi, I'm Paula Kirker, president of PBS, and I'd like to personally thank you if you've made a contribution to Arizona PBS. You know, when you fund your favorite shows on this station, you're ensuring great television continues to be available for yourself, your family, and everyone in your community. One of the easiest ways to do that is by making a monthly contribution on an ongoing basis, what we call sustaining membership. When you call, tell us how much you'd like to donate each month. Our current sustainers tell us that $10, $15, or $20 a month is best for them, but you decide what works for you. After you've made that call, we will deduct that amount each month from your credit card or your bank account, and we will continue until you tell us otherwise. Your membership will always remain current, and renewal notices will become a thing of the past. Best of all, your ongoing support means that the best television on television will continue to come your way every single day of the year. So please, consider a sustaining contribution today. Thank you for your support of this PBS station.
This is National HIV Testing Day. Phoenix is among a handful of cities supporting the 90-90-90 initiative, which looks to better identify and help those living with HIV. It's part of a larger 5-year plan to end Arizona's HIV epidemic. Here with more is Kit Kleckel. He is with Aunt Rita's Foundation, and Tamara Spendley, program coordinator with the City of Phoenix. Almost got you all mixed up. Good to have you both here. Thank you so much. And we'll start with you. And this theme, Test Your Way, Do It Today. What are we talking about here?
How important it is for everybody to get tested. So the City of Phoenix became, just this past year in 2016, a fast-track city, one of the very few cities to become one, to end the HIV epidemic with the 90-90-90. So part of that 90 is knowing your status. So it's so important to get tested, and that's what we really want to make sure the community knows.
She just mentioned the HIV epidemic. Is it still an epidemic?
It is still an epidemic. Here in Arizona, we're actually going the wrong direction. We actually are increasing HIV infections rather than decreasing. So it really is important. The earlier you know your status, that you're going to live a long, healthy life if you're HIV positive. But the earlier you know your status, the healthier your life is going to be. So it's really important to get tested.
Again, the 90-90-90 initiative is 90% knowing your HIV status, 90% getting the therapy needed, and 90% living with total suppression. How many do you think, ballpark guess here, don't know their status?
We're saying approximately 15% now. We believe about 85% do know their status, but the 15% that don't know their status are the individuals that are really putting the community at risk. And we need to find those individuals, get them tested, and get them on antiretrovirals.
How do you find them? How do you get them tested?
Well, that's where we started the work group. We have the task force where the Vice Mayor Pastor and Councilman Valenzuela co-chair our fast-track cities. And we brought together the community, the advocates, we have the state, the county working together on this plan on how are we going to do that. And so our goal is to find those by working with the state, find out who the highest number is who are now reportedly with HIV, going out into that community and finding out, why they didn't get tested earlier and what are some of the barriers working with them.
What are some of the barriers?
That's what we're working with.
Well,
yeah.
I think the biggest barrier is social stigma. There's huge stigma around HIV and revealing that you're HIV positive. I was diagnosed in 2005. And I actually was diagnosed with AIDS, which means I waited too long to get my HIV test. So my message is get tested, do it early. Don't let the stigma bother you. It's no shame in knowing your status.
The 90% also is make sure 90% can get antiviral therapy. Talk to us about that, how that has come along, how that has progressed over the years. You're looking pretty healthy right now. It sounds like things have moved forward.
They really have. I am now on 1 pill a day. When I was first diagnosed, I was on a two drug regimen, 4 pills and then 1 other pill of Truvada. And now I'm on 1 pill a day. And I do everything I can to protect my health. I am undetectable, which means there is a 96% chance that I cannot transmit the disease to anyone else.
Interesting. Okay, so we got 90% knowing your status. You got 90% getting the therapy. 90% total suppression. What does that mean?
And that's kind of what Kit talked about, is being totally suppressed by being on the medication, staying on the medication, staying on top of it, visiting your doctor annually, getting those checkups, and making sure you take the medication properly.
What about costs?
Costs are expensive. On average, it will cost an individual, or the cost to treat an HIV-positive individual over their lifetime is in excess of $400,000. My drug costs that are out of my pocket this year are going to exceed $5,000. So, and that's my portion of the drug cost. Drug costs are about $2,500 to $3,000 a month.
So with that in mind, you've got folks that are low income, you got homeless folks, you've got substance abusers, you got folks who are simply not going to be able to pay those bills. What do you do?
There are programs for it. We do have the Ryan White program, so we do have programs.
Talk to us about those programs.
So the county has the programs to help assist people, so we want to make sure everybody realizes this is not a death sentence anymore. I mean, it's a disease. Get rid of that stigma, so get the tested so you can. Different agencies are working together with us and partnering. Even the pharmaceutical companies said they do not want to make sure nobody can't afford their medication. They have plans to help the community.
So 90-90-90, are these realistic? Are these attainable goals?
I think they are. I think until the city of Phoenix got on board with this, it would have been very difficult for us to achieve it. But I think with the effort that the city has shown, and we're very proud of the leadership that the city council and the mayor has taken, I think we have a very good chance of achieving our goals.
Encouraging information. Good to have you both here. Thanks for joining us.
Thank you.
At the entrance of Bullhead City's Community Park on State Route 95 is a marker honoring northeastern Arizona's vital relationship with the Colorado River. For nearly 30 years, in the mid-1800s, commercial steamships served the mining communities of northern Arizona, hauling supplies from as far downriver as Yuma. Cargo was unloaded at nearby Hardyville, often returning downstream with barge loads of local ore. Bull's Head Rock, from which Bullhead City derived its name, was located just upstream. The escarpment was used as a navigation marker and the point where Mojave Indians forded the river. Bull's Head Rock was submerged in 1953 with the building of Davis Dam. Today, the Colorado is still Bullhead City's lifeblood. Jet skis have replaced the steamships, and Laughlin, Nevada's casinos just across the river have replaced the mines, mining tourist wallets instead of the ore from the mountains.
ASU's women's golf team recently won the NCAA championship, and Monica Vaughn took home the national individual title. It was an impressive feat for an already accomplished program. Sun Devils beat Northwestern in the finals to win its record 8th national title, and Vaughn rallied from 4 shots back with 4 holes to play to become ASU's 6th individual champion. Joining us now is ASU women's golf coach Missy Farr-Kay, and we also welcome Monica Vaughn to Arizona Horizon. Good to have you both here. Thanks for joining us.
Thank you for having us.
Has all this sunk in yet?
Oh, we're still processing it. It's been a wonderful ride.
How did you feel about this team and the players before the season started? Could you see this? I mean, everyone has optimism, but could you see something like this?
You know, back in January, we sat down as a team and talked about our goals, and we had kind of a little bit of a retreat, and we really talked about who we wanted to be and what the different qualities were. And the biggest thing, I think, we made a commitment to each other that our tagline was all in until May 24th, and that was the last day of the championship. And I think that once everybody really kind of fed off of each other and really made that commitment, I saw something really unique happen with this team and their chemistry, which helped us, I think, be so successful.
Oh, I'm sure. When the season starts, everyone wants to be the best. The goal is to be the best. National champion is about as good as you can get. Was it realistic? Were you thinking about that in particular?
It was very realistic, and actually that's funny that you say that, because so many people just kept coming up to me and saying, I can't believe it, this is unbelievable, this is incredible, and I just kept saying, it is believable. I totally believed it from the beginning. It was realistic for me, it was realistic for my teammates and my coaches, and you know, even the girls on the team just kept saying, I can't believe it, and I said, believe it, we did it, you know, this is what we worked for all year, and this was the goal all year, and we accomplished it, and it was totally believable.
And you accomplished as individual champion. The teammates, your coach, I mean, how big a factor is that, just that relationship? I mean, it's got to be a good relationship. That's one less thing for you to worry about out there.
Yeah, I mean, to have such great chemistry as we did out there was a huge benefactor for us, because without that kind of chemistry and without that atmosphere and spirit from everybody on the team, I really think that we wouldn't have been able to do it like we did, because, you know, you could maybe not even agree with each other, or not have the greatest chemistry all year, but when it comes to the national championship, you better have it together. And
yes,
we did, and we had it together from the beginning of the year.
You could really tell. You played on a national championship team.
Did.
You were an assistant coach on a national. Now you're the head coach on a national champ. What's up with you?
Well, I'm at a really good place, at a really good school. You know, I grew up in Phoenix, born and raised, so, you know, ASU is 10 minutes from where I grew up, and, you know, it's a really special place with some really special people, and it's a really unique environment and culture for us.
A golf coach. What does a golf coach do?
That's a great question.
On a team like this.
That's a great question. A golf coach, we wear many hats. One day I'm a mom, so some day I have my mom hat on. Some days I have my 25-cent psychology degree. You know, you're a nurse, you're a triage nurse, you're all these different things. You know, and then you're a general manager. You have to pull from, you know, from your medical team to your academic coaches to your strength and conditioning staff. You have to oversee all of that. So it's a wonderful job, because it's never dull. It's never the same. No day ever looks the same.
Yeah, and it's more than just, I think your grip's a little off.
That is true.
Yes, a lot more than just.
It's a lot more than that. The mental side of it is a huge part of what we do.
Let's talk about the mental side. 4 strokes down with 4 holes to play. All right, you're 4 strokes down. Are you talking to yourself? Are you telling yourself, quit talking to me? I mean, what are you thinking out there?
I actually didn't know. I had no idea that I was 4 strokes behind. I didn't know where I stood relative to the rest of the field. I just knew that I was up there at the top. But, you know, I missed a really short putt on my 14th hole of the day, and I made a bogey, and I really thought that I had set myself back and that I might not be able to recover. And I had 4 holes left, and I said birdie 2 out of the next 4 holes, and I birdied 6 and 7, so I knew that I gave myself a chance.
When you tell yourself to do this, I mean, I play golf poorly, but I play it, and I know that I can tell myself I need to do it. Never happens. How do you make it happen?
I don't know. I guess I just really believed that I could, and I know that I've done it in the past. Over all the years that I've played golf, I just thought about all the times that I've ended around birdie, 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 or started birdie, 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 you know, and I just knew that over the course of the years I've played golf, I've birdied all 18 holes out there sometime. And
you mentioned, you know, the psychological aspect and the mom aspect. How do you, when the team was dead, the team had to come back in the semifinals, big time.
Right.
What do you do, or do you do anything? Do you leave them alone? How do you handle that?
You know, I think, I mean, I've been doing this for 15 years now, only 2 as a head coach, and I think that where I've grown as a coach is to learn there are times that you just have to surround them with love and belief. And, you know, when I was there when Mo missed that short putt on 5, and it was painful because it was a really short putt. And so, you know, a few years ago, I would have probably been like, ah. And instead I was like, hey, it's fine, you're good, no problem. Let's go. And then I walked with her the last 4 holes, and I wanted to just enjoy walking the last 4 holes with our senior. And I just kept saying, we didn't. We all made a commitment to not look at scoreboards, the outcome was going to be what it was going to be, and we were going to be okay with that. And we were going to give it everything we had, and then we were going to be, then we won, no matter what, we won. And so I said, and I knew she had a shot at it, but I said, don't worry about it, let's go. We'd make jokes and we'd laugh and try to keep them as loose as possible. And if they start to falter, say, you're fine, it's okay. And keep them calm, and that was really the commitment as coaches that we made to the team.
Well, it certainly worked. What's next for you now? You can't come back and defend or anything. You got to get out of here. What's next?
I will be turning professional and playing in my first professional event in July in Ohio at the LPGA Marathon Classic. So I'm really looking forward to that. I'm very excited. I just recently made that decision about a week or two ago.
Wow.
So. And then I'll be playing in qualifying school coming in the fall.
Wow, big step. Good luck to you.
Thank you.
And, you know, what's next for you? I mean, you've won at every level. How do you get yourself up for next season?
Well, I think that's the challenge as a coach, to continue to get better and find different ways to do it. And we're off on the recruiting trail all of July and try to sneak in a little family vacation. But there's, you know, the minute you stop learning and growing as a coach, that you should probably get out. And I can't wait till when we start again next year to come back and see what we can do next year.
Well, congratulations.
Thank you.
Great job. And congratulations to you. Great job as well. And good to have you both here.
Thank you very much.
Thank you. Wednesday on Arizona Horizon, we'll discuss how Arizona businesses might be impacted by the Senate Republican health care plan. And we'll talk education issues with State Superintendent of Public Instruction, Diane Douglas. That's Wednesday on Arizona Horizon. That is it for now. I'm Ted Simons. Thanks so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.